My name is Caroline Cueva. In this video, we will be discussing what gamma rays are and the effect they can have on the human body. We will look at the population at risk as well as prevention options. Let's get started. Gamma rays are weightless packets of energy called photons. They are similar to visible light but have a much higher energy. Gamma rays are a radiation hazard for the entire body. They can easily penetrate barriers that can stop alpha and beta particles, such as skin and clothing. Gamma rays have so much penetrating power that several inches of a dense material like lead or even a few feet of concrete may be required to stop them. Gamma rays can pass completely through the human body. As they pass through, they can cause ionizations that damage the tissue and DNA. Now, let's take a deeper look into what ionizing radiation is. It's any type of particle or electromagnetic wave that carries enough energy to ionize or remove electrons from an atom. Ionizing radiation has sufficient energy to affect the atoms in living cells and thereby damage their genetic material. Ionizing radiation includes radon, X-rays, gamma rays, and other forms of high-energy radiation. These forms of radiation can be released in accidents at nuclear power plants and when atomic weapons are made, tested, or used. The community most susceptible to ionizing radiation is children and fetuses. They are especially sensitive to radiation exposure. The cells in children and fetuses divide rapidly, providing more opportunity for radiation to disrupt the process and cause cellular damage. Now let's discuss risk evaluation. There are three main types of exposure. The first is natural background radiation, which comes from cosmic rays from our solar system and radioactive elements normally present in the soil. This is a major contributor to worldwide radiation exposure. The second is medical radiation, which is used for X-rays, CT scans, and other tests, as well as for radiation therapy. Radiation therapy is used to treat some types of cancer and involves dosages many thousand times higher than those used in diagnostic X-rays. Radiation is very effective as a cancer treatment because it can kill the cancer cells. However, it can also kill or damage nearby cells. When radiation is used to treat cancer, it must be pinpointed very carefully. The final kind of exposure is non-medical man-made radiation. This is used in small amounts in food irradiation, airport security scanners, and some consumer products. Exposure to man-made radiation can happen in certain workplaces or in communities as a result of above-ground nuclear weapons testing and nuclear accidents. An example of this is the Chernobyl nuclear accident. The most important thing to remember is the risk of cancer from radiation exposure increases as the dose of radiation increases. Likewise, the lower the exposure, the smaller the increase in risk. Now that we know how individuals are exposed to gamma radiation, we can practice avoiding it. There are three general guidelines for controlling exposure to ionizing radiation. The first is minimizing exposure time. The amount of radiation exposure increases and decreases with the time people spend near the source of radiation. The second is maximizing distance from the radiation source. The farther away people are from a radiation source, the less their exposure. Doubling the distance from a point source of radiation decreases the exposure rate to a quarter of the original exposure rate. The third and final is shielding yourself from the radiation source. As ionizing radiation passes through matter, the intensity of the radiation is diminished. Shielding is the placement of an absorber between you and the radiation source. An absorber is a material that reduces radiation from the radiation source to you. Thank you for listening and enjoy the rest of your day.